Most of us in this room aim for a perfectly harmonious office, but as clinical leaders, we have to realize that harmony can sometimes be the ultimate enemy of growth. If every single person on your team thinks exactly like you do, your practice will be relaxed and conflict-free, but it will also almost inevitably stagnate. Homogeneity provides a comforting stability that minimizes stress, but that same stability often blinds the practice to emerging technologies or shifting patient expectations. On the other hand, a team of opposites brings an explosive creativity that can lead to breakthrough results, yet it carries the risk of friction. A diverse team challenges the status quo, forcing us to examine inefficient habits like manual charting or outdated systems. That tension, when properly managed by strong leadership, acts as a crucible for true innovation, leading to better processes and superior communication strategies. In the world of lean orthodontics, we view team composition as a strategic lever for practice efficiency. A leader must constantly assess whether the current goal is stabilization, requiring homogeneity for process adherence, or transformation, requiring diversity for radical problem solving. This decision should dictate your entire recruiting strategy. The key to successful leadership is knowing when to lean into homogeneity for stability and when to intentionally inject diversity to drive innovation. For example, when redesigning your clinical schedule flow, an experienced manager who values structure must work alongside a younger, tech-savvy team member. This clash of viewpoints ensures that the new system is both compliant and modern, rather than just a digital version of a broken process. One of the most common challenges in modern management is the generation gap. You likely have veteran staff members working alongside Gen Z trainees. The veteran understands your unspoken clinical cues, while the newcomer feels like they are speaking a different language. This gap can lead to a breakdown in team performance, manifesting as friction over technology adoption or interaction styles. Veterans bring institutional memory, knowing which past protocols failed and why, while new hires bring native fluency with digital tools and an understanding of how today's patients prefer to engage. To bridge this, a proactive leader identifies a bridge person, someone in a middle age bracket with high emotional intelligence who translates experience into modern language and trains the newcomer on practice culture without dismissing their expertise. Successful practices formalize this bridging through structured mentorship. We must realize that the level of diversity you need depends on the goal of the specific department. You need a diverse team for innovation and expansion. Opposing ideas must collide to inspire new ways of acting and to question old habits. By recognizing that a diverse set of eyes leads to more robust systems, we protect the clinic from the blindness that comes with routine. This is crucial for marketing, finance, or when launching a new service line. You need team members with different backgrounds to fully vet the feasibility of the initiative. Conversely, if you need fast communication for repetitive tasks, such as sterilization or chairside assisting, a more homogeneous team is superior. In these areas, deviation is risk and consistency is quality. In my own clinics, our medical team of doctors is highly diverse by design. We intentionally use our varying perspectives to debate clinical opinions, ensuring the patient journey is backed by a multi-angled strategy. Meanwhile, our front office scheduling team is trained for high homogeneity in patient greeting and checkout. This dichotomy ensures that patient-facing interactions are reliably excellent, while treatment planning remains intellectually rigorous. Strategic team assembly is about aligning your human resources with your long-term vision. It requires an intentional, department-by-department assessment of operational needs. You are not just hiring for a position, you are designing a cognitive ecosystem that supports your clinical ambition. By understanding the backgrounds and personality types of your staff, you can build the bridges that turn potential chaos into solution strategies. A high-performing practice views diversity not as a challenge, but as a resource to be strategically deployed. When managed correctly, this intentional diversity translates directly into higher case acceptance rates, improved online reviews, and a significant reduction in clinical errors. A well-composed team doesn't just work together. They complement each other to create a practice that can serve a wide range of patients with excellence. This strategic approach to human capital is the definitive mark of effective dental leadership. Thank you for your time, and I'll see you in the next video.